And we are back. Joining us, the National Urban League's Mark Morial, the House Republican Whip, Congressman Eric Cantor of Virginia, and House Democratic Chief Deputy Whip, Congresswoman Wasserman Schultz of Florida, plus two Washington journalists, Ron Brownstein of the National Journal and Katty Kay of BBC World News America, plus two minor league round draft picks to be named later. We have our own healthcare summit here. We have a big group. Welcome to everybody. Congressman Cantor, let me begin with you. The big question is, where are we after this summit, after all the machinations and negotiations? Are there the votes in the House to get this done?
Well, I'm sure my colleague will have something to say about that. But, David, there's a reason why we're here with no health care bill having been passed. And that's because the American people have decided this is not the health care bill for them. And that's why you heard during the 7-hour discussion that we had at the Blair House with the President, Republicans come to the table and say, look, we do care about health care, and we want to do something to affect positive reform. It's just that we want to take a much more common sense, modest, incremental approach, trying to address the first issue first, which is cost, and then go on to try and deal with some of the things that the President and Speaker Pelosi want to do.
All right, we'll come back to that, but in terms of what the general approach is. But Congressman Schultz, are there the votes in the House, which is really the big testing ground here, if it's reconciliation, for instance, where you go for a simple majority? Are the votes there?
When we start counting, the votes will be there, because the American people want to make sure that we take the abusive practices that the insurance companies engage in and make sure that we put doctors and patients back in the driver's seat. Right now, it's insurance companies that decide what kind of coverage you have. Right now, it's insurance companies that can drop you based on a pre-existing condition. I know that from personal experience. Right now, you can get dropped when you become sick. We've got to make sure that we put doctors and patients, not insurance companies, back in the driver's seat. And if you look at the polling, if we're going to talk about polling, that the American people have weighed in on, they support the components that are included in this bill because they want to make sure that we end abusive practices by insurance
But Mark Morial, the composite of all of those, the difficulty that the President faces, is that he has not sold the public on his version of health care reform. That's the reality of his situation right now. I spoke to one very close ally of the President's on this fight, saying he thinks 40% chance this ultimately gets done. Where are we?
I think that there's a strong chance that it's going to happen because it needs to happen, because beyond the politics of Washington and the infighting, the fact of the matter is there's a problem in this nation, and that is there are many people uncovered, and for those who do have coverage, costs are exploding. So I think that the President rightfully went back and had a discussion which was a health care summit. Some may have said it didn't make good TV, but what it did is it showed that the discussions are substantive, that the issues in fact are serious, and I think at the end something should get done and something will get done because it needs to get done.
You know, it's interesting, Ron Brownstein and our congressmen and women will talk about some of the philosophical differences. For all the talk of the petty politics, one thing that came through the summit is that there are very big philosophical and ideological divisions about the role of government in the healthcare system and how many people should be covered, particularly given the finances during a recession.
Absolutely. I mean, I think one of the real points that came out of the summit was the depth of the disagreement between the parties. And in fact, each party's health care plan, I think, largely crystallizes their view of the role of government. And they differ not only in their solutions to the problem, but their definition of the problem. I mean, we're not really, to use the President's term, comparing apples to apples. The President's plan, the Democratic plan, attempts to cover roughly, by the CBO estimate, 33 million people who are uninsured over the next decade. The Republican plan, by the CBO estimate, aims to cover 3 million people. It is a much more minimalist plan. It's basically recycling ideas, the association health plans, the interstate sale of insurance, the medical malpractice that Republicans pushed and were unable to bring into law when they held unified control of the House and the Senate and the White House in the middle part of this decade. They were unable to build enough public consensus for those ideas when they had unified control to get them into law. So, I mean, I think what we're seeing here, the reality is healthcare is a very difficult issue. It has defeated every president who has tried it for 70 years. It's a very complex problem. And what you're seeing in the end are fundamentally different visions of the parties about how to attack this and really what even you are attacking in the end.
What about the President's leadership on this, Katty?
I don't think that the summit changed things either way in terms of the potential for passage or not passage of this reform bill. And one area where I think the President hasn't managed to try to get those poll numbers to shift in favor of reform is to say to Americans, listen, you may have a level of care at the moment that you're happy with, but if we carry on with these exploding costs, care will deteriorate. At the moment, America has globally the 37th highest quality of care in the world. That puts it just above Cuba, just below Costa Rica. Now, is that where America sees itself in terms of its quality of care? And that number will decline. It's going to slip down the global pole of where its level of healthcare is if something isn't done about healthcare reform. And that's an argument that the president hasn't managed to get across. I think the other thing he hasn't done is really appeal to a sense of generosity in the American people. I travel around the country and I've seen the poll numbers, but I'm struck by how many Americans say to me, we don't see ourselves as a country that doesn't allow people access to a doctor if they don't have insurance. That's just not how Americans see themselves. This is the country that gives the highest level of charitable donations in the world. Americans think of themselves as a different country.
And yet, all of you can weigh in on this. The tension seems to be that individual elements are popular. You can talk to people who want better health care, better access to health care, reform. But there's a lot of distrust that government can deliver this kind of care and handle it well. But isn't that the fundamental tension?
The fundamental delivery system here will be the private insurance system. That's what's key. This is not the government running insurance. It is changes to how health care is delivered. But what it would do would be to provide opportunities for more Americans to purchase private insurance. And I think there's been a great deal of confusion. This is, in essence, a partnership between the government and the private sector to expand health coverage. And I think that it's been confused by talking points. It's been confused by political broadsides, but that's essentially what it is.
David, the reality is, and take a little bit of different approach here and difference with that statement, the reality is Republicans do care about health care. We want to address the first and most foundational element, which is cost. Because if we can bring down costs, more people can access care. But we also know that there is something we need to do to get more people uninsured. The problem is with the president's bill, it's about expanding Medicaid. No one wants to go on to Medicaid. That's why physicians in Florida and other states are leaving Medicaid in droves because of the imperfect reimbursement structure. That's what this bill is about, is expanding the government programs that don't work. We need real reform to bring down costs.
David, you want to talk about bringing down costs. Our bill makes sure that we address the problem of every family in America having a $1,000 hidden tax for covering the uninsured. There's 47 million people in America that don't have insurance, and we are all paying for them because they show up at the emergency room as their primary access point for health care. In order to reduce costs, we can cut a tax of $1,000 on American families just by covering those people. We can also make sure that we bring down costs by broadening the pool, adding the healthiest people who are choosing right now to not carry health insurance, and then when they get hit out of a clear blue sky by an unexpected illness, they don't have insurance, and we're all paying for it.
Well, let's reality check this for a second, Ron. The claim by Congressman Cantor that there isn't cost reduction here. We're not lowering costs. Is that accurate? Look what the CBO says about the effect on the deficit.
There are two ways to look at this. The CBO says that the Democratic plan would reduce the deficit. Republicans believe that many of the changes in Medicare would not be implemented in the long run and call that into question. The broader question of what it means to overall national health care spending has been analyzed by the Medicare actuary, which is an independent position. And what they concluded was that between now and 2019, if you did the Democratic plan, you would insure 33 million people, and total national health spending would increase by less than a penny on the dollar. So does it break the back of rising costs? No. But does it reallocate resources within the medical system more efficiently, potentially, than they are now? Clearly, the actuary is suggesting, yes, if you can cover 33 million more people at a total cost of less than a penny on the dollar increase in our total national health expenditures, that is a part of the debate that has not come through. Can I go back to your point, though, very quickly, which was, you're absolutely right. Even though individual elements of this plan do poll well, overall, Democrats have never been able to get into a position where most Americans, particularly most white Americans, because there is a difference between minorities and whites in the polling, believe it will help them and their family. That's why this is, I think, a real gut check moment for these Democratic majorities. I think if you poll them privately, clear majorities in both chambers will believe they have produced a plan that is a reasonable way to approach universal coverage if that is your goal. The question is, do they believe they can sell it to the American people if they go forward with it? Because as you say, right now, they haven't. And Republicans, I think, exuded confidence at that summit that they believe they are winning this argument.
So, Congressman, what happens between now and the point at which you say you have the votes? What is the president going to say this week? How will he justify reconciliation going for a simple majority in a way that a congresswoman other than yourself, who presumably can cast a vote for this safely in her district, how do other members of Congress go back and say, no, this is a good thing, we're going to do this?
Because the American people support the pieces of this plan, and after Thursday, they see through the Republican mantra that we need to start over. Start over means do nothing. I mean, make no mistake about it, it's disingenuous for my colleagues to suggest that they really want to cover people when the only thing they've got out there covers 3 million people. Nothing in their plan would bring down costs. We have the largest tax cut for small businesses and people who pay for health care in our bill in American history. And that's the bottom line. We have cost reduction, we have comprehensive coverage, we cover 31 million people, and they don't even come close.
But, Congressman Cantor, let me rebut that by asking this. What specifically, you have the bill piled up in front of you, what can you say yes to that's in the president's revised proposal? Anything?
We can, listen, Dave, let's take a step back for a second, because this notion that somehow Republicans never came forward with solutions, I think the American people are over that now.
Well, hold on, but what you said specifically is there is a big difference in scope, 30 million covered versus 3 million covered, difference in the role of government.
And what we say is this, our approach is an incremental approach. It is not do nothing. I think that's a tired argument.
Very little.
It's an incremental approach. Let's talk about doing the first thing, which is bringing down health care costs. That's how this whole debate began over a year ago at the White House when the president had his first summit. Then we go about trying to do the kind of things. Well, we certainly, the CBO has validated that we bring down health care insurance premiums without a doubt. So that helps folks who have it, and we can expand coverage. We also say, look, we don't approve of denial of coverage for pre-existing conditions. We have a plan. Absolutely, it's in our bill. We have a plan that creates universal access programs at the state level, which allows folks to access insurance if they're denied by their insurer. David, let me just
quickly respond to anything there that you think.
Well, no. In fact, CBO has estimated that both plans, both the Democratic plan and the Republican plan, if you're looking at existing insurance, your existing insurance plan, would bring down premiums by about the same amount for the apples to apples. CBO says roughly for the Republicans 5 to 8, roughly 7 to 10% for Democrats on the effect on the same plan. Now, the reason why the cost goes up, and this is a question I think Democrats are going to have to answer as they go forward on this, is that they are mandating a richer plan than in some cases a more comprehensive plan than people now have as the baseline in these exchanges. So one of the questions I think Democrats may be asking themselves is, can they bring down the cost of this somewhat by moving back away some of those mandates? But if you look at the CBO analysis of both kind of core proposals in terms of their impact on insurance premiums, it's very similar.
Let me get Kat in here for a second on this question, too, of what are Republicans saying yes to, which goes to the overall question is the politics for Republicans here. What's it worth to them to have any sort of reform or not to?
Well, it seems to me at the moment the politics for Republicans is to carry on saying no. I don't see where the value for the Republicans politically is to signing up pretty much to anything. They do believe that they have public opinion on their side on this, and they will be able in November, if health care doesn't pass, to turn to the public and say, look, the White House was expending an awful lot of energy on trying to get the president's signature bill through when what he should have been concentrating on was jobs and the economy. And you can see the Republican ads being written at the moment if this bill isn't passed.
Here's what the people deserve. They deserve an up or down vote, and not a lot of procedural delay tactics, the use of all sorts of measures. The people deserve an up or down vote on health care. Let everyone put their proposals on the table. Let the House of Representatives and the Senate vote it up or down.
I think
let me explain right now, because I'll tell you one thing. If Speaker Pelosi rams through this bill through the House using the reconciliation process, they will lose their majority in Congress in November.
Hold on, let me just follow the issue of reconciliation. But Congressman, reconciliation has been used many times before by the Republicans.
Absolutely. Listen, there are differences in every instance when reconciliation was used. This is something, health care, that is going to alter a significant portion of our economy. And if they do this, the public does not like this bill. And so it's that somehow the Democratic majority just won't listen to the public.
I need to respond.
And don't allow us to
let me respond to what he's saying here.
Quick comment.
Because the Republicans have repeatedly said that they agree with 80% of what's in our bill. And at the end of the day, what we need to do is sit down and negotiate over the differences on the 20%. The Republicans right now are focused all about regaining power. They don't have any interest in us accomplishing comprehensive health care reform. That's been evident. There isn't anyone that is saying, come on, let's just work this out. What they're saying is start over. Start over, the American people understand, means do nothing. Because if we are successful...
Final point before I move to the politics. Congressman, I want this very narrow point. What would be in a revised bill that you could vote for? What out of all of the president's ideas could you support now?
Well, we could start with implementing real medical malpractice reform. We could start by creating universal access programs at the state level to allow those who are being denied coverage by the insurance company right now the ability to access insurance. We could put in place the real ability for people to purchase insurance across state lines for real competition.
And if those elements, for instance, those three elements, you could vote for them?
If you listen to my discussion and my comments with the president at the Blair House, when he asked that, I said, look, it is the construct of the bill. It goes back to the level of mandate from Washington. And the president and I had an exchange about why is it that we need the Secretary of Health and Human Services here in Washington telling people what benefits.
I want to just hold on. I just want to move. I want to move beyond some of the fine points of this to go a little bit larger in terms of the politics. Charlie Cook talked about what all this means politically this year. And this is what he said in a report as Politico reported it this week. I think choosing to take a Captain Ahab-like approach to health care, I'm going to push for this even in the worst downturn since the Great Depression, is roughly comparable to Bush's decision to go to war. It basically destroyed the first year of a presidency. Does the president come through this, however it turns out, tarnished in some way? Is he hurt as he goes into the midterm race?
No, I think to some extent the whole debate politically about reconciliation is a little bit of a red herring, because if this bill passes and it proves to be popular with the American people, it will be judged on its merits. If it passes and proves to be unpopular, it would also be judged on those merits. People will soon forget how it was passed. That's what happened with welfare reform. It took all of us a little while to dig out our books and remember that welfare reform was actually passed through reconciliation. People don't remember the bickering beforehand. They will support or not support this bill on its merits. Now, the problem, I think, for the president is that this is gumming up all of the time he needs to be spending on other things. Business leaders are going to the White House and saying, we cannot make decisions about trying to hire people because we don't know what our costs are going to be. We don't know what our healthcare costs are going to be. We don't know what the energy plan is going to be. We don't know what the tax reform is going to be. So they're not making decisions. They are frozen because Washington is frozen, and he needs to get moving on these legislative
Mark, the debate, of course, is how close does the president get to legislation like this? There's a reason why, with all respect, members of Congress often suffer in their popularity because sausage-making, lawmaking is not a popular thing in the public. Does he risk the tarnish of being too close to the process now that he's decided to get this close?
I think he takes credit for being able to get something very big and something significant done. Poll numbers change. Public opinion changes. What people are reacting to is a messy, confusing process. I think that a victory on health care will help the president. He staked his first year of the presidency on it. People can debate whether he should have done something else, but the fact of the matter is he's on the goal line, and now I think people want to see him get the ball in the end zone and pass his plan.
Ron, the effect on the election.
I agree with both of them. Look, I think that this really is a gut check moment for the Democrats. They have not won the debate to this point, and it's not unusual. Every other president who has tried to do this has found it is very difficult in a prospective manner to convince the country that government can reform a system this complex, especially at a time we have such distrust of government after the 2008 financial meltdown. And I think the choice before them is exactly right. As Kathy said, I don't think people are going to remember very long how this was done. If they do go ahead with this, they would have to do so in the belief that they can turn around those poll numbers and convince the country that this is worth doing. And ultimately, this has been, a top priority for every Democratic president since Truman. They are, as Mr. Morrell says, on the goal line. And if they don't do it, I think it would be a striking admission that they do not believe that in the end they can win this argument about an issue at the core of the party's mission for many decades.
Let me move on. There was another question I wanted to ask you regarding Charlie Rangel, Congressman Rangel of New York, who was criticized by the Ethics Committee for a series of trips that he took down to the Caribbean. Should he retain his job?
Well, I think obviously when a member is found to have violated House ethics rules, it's a very serious thing. And there are a number of other investigations that are ongoing. And I think what Speaker Pelosi has said is that we need to look at the totality of those recommendations and wait till all the investigations are completed before a decision is rendered on that.
But you're concerned about the finding?
Obviously, any time a member is found to have violated House ethics rules, it's deeply concerning.
What's going to happen, Congressman?
Look, Nancy Pelosi said in the very beginning, this is going to be the most open, honest, and ethical Congress in history. And what we're seeing, she's breaking that promise every day. And I'm sure my colleague would join me in saying that the American people would say right away, Charlie Rangel should step aside from being chairman of the most major committee in Congress after having been found to be in violation of House rules. And as we know in press reports, this is only the tip of the iceberg. So, listen, I called for his stepping down before even this finding, and now I do think it's time.
Ron, does he make it, do you think?
This is the first. I think that this is not enough by itself, but I think many Democrats are expecting that the further revelations on the ongoing investigation on his financial dealings may create irresistible pressure.
Charlie support Charlie Rangel, and his future is up to the voters who elected him. He's had a long, great career in Congress, and I think there's always going to be a lot of back and forth about ethics investigations, not to sanction what he said, but his future should be up to the voters of his district.
Patty, another interesting point, another political situation in New York. Governor Patterson saying he will not pursue his campaign for governor, striking because here you have the Obama administration who tried to get him to back out of this race months ago unsuccessfully, and now the scandal involving his administration and any potential interference with a domestic violence situation involving one of his aides has now come to the point where he's still in the job, still calls for him to resign outright.
Front-page paper calls for him to resign out from nearly all of the New York City papers included. I think it's a suggestion, isn't it, that the White House's bid earlier to try to get him to resign, it's an indication of the limitations of the White House's clout when it comes to Democrats all around the country. I mean, they've had this problem in elections across the country as well. They're trying to support Democrats who didn't then get elected. It is something that makes the White House not look particularly powerful.
It's a measure of the kind of year it is right now for Democrats. That often the best headline for them this year is when somebody steps aside in the race. Bill Ritter, Chris Dodd, Patterson. I mean, that is a tough year when the good ones, when somebody isn't running.
It was the White House who asked him to step aside, and then he had stepped aside.
Good, final point.
The bottom line when it comes to ethics reform is that we got the ethics committee, Democrats got the ethics committee moving again. It's an effective process that was totally neutered under the Republicans, and now we have an ethics committee that is fully functioning and making sure that we take care of the ethics problems when they're there.
All right, we are going to leave it there. Thanks to all of you. Covered a lot of ground. We will talk more with Mark Morrell about the National Urban League of service to American communities. It's in our Meet the Press Take 2 Web Extra. It's up this afternoon. Plus, look for updates from me throughout the week. It's all on our website, mtp.msnbc.com. And we'll be right back.